Hi, this is David Parra from AARP. Welcome to this presentation on the healthcare law, how it benefits you. Please keep in mind that you can pause, rewind, or fast forward this video at any time. President Barack Obama signed into law the Affordable Care Act in March 2010. In this presentation, we will provide an overview of the key improvements within the healthcare law as a starting point to get you acquainted with the law and some of the key provisions. This session will go over what the law means for several groups of people: those who have insurance, those who do not have coverage or who buy coverage on their own, people with Medicare, those who are planning for their long-term care, and small business owners. We will point out when the various provisions of the law go into effect, and we will also tell you where you can go for more resources and information. The first group we're going to discuss are people who currently have health insurance. If you are in this group, you may have been wondering how the healthcare law is going to affect you. First, the law makes a number of changes that protect you from discriminatory insurance practices. All of these are in effect right now. For instance, as long as you continue to pay your premiums, health insurance companies cannot drop your health coverage if you become sick or disabled. This is a huge provision. There are also protections in place to make sure you are not charged excessive premiums because of your age, gender, or health condition. Another important change is that children under age 19 cannot be denied health insurance because of a pre-existing condition, such as cancer, diabetes, and heart disease. This provision will also extend to adults by 2014. The law also makes changes in the limits that an insurance company can place on your coverage. Before the law was passed, some insurers could limit how much they pay for your care during the year and over your lifetime. So, once your insurance coverage ran out, you would either have to pay out of pocket for all of your medical expenses or go without medical care. Under the healthcare law, insurance companies will not be allowed to limit how much they will pay for medical benefits over your lifetime, giving you peace of mind that your benefits won't run out when you need them the most. In addition, they won't be allowed to limit how much they will pay for your medical benefits over the course of a year. The ban on lifetime limits is in effect now, and the ban on annual limits starts in 2014. Another change under the law is in the area of preventive health services. This year, for people with new insurance plans, you will no longer have to pay some of the out-of-pocket costs for preventive care, such as mammograms, immunizations, and screenings for cancer or diabetes. Check with your insurance plan to see which of these services are covered at no cost to you. As we all know, there are many Americans who either do not have health insurance or who have to buy their own insurance. And if you ever have to buy insurance on your own, it can be pretty confusing to figure out how to compare plans and prices. Let us look at how the healthcare law will affect this group. If you are uninsured or buy your own coverage, the healthcare law will make it easier for you to buy health insurance. If you are an uninsured individual, or you own a small business, or you are self-employed, you will be able to purchase health insurance through state-based purchasing pools called exchanges. The exchanges must begin offering health insurance in every state by year 2014. All health insurance plans in the exchanges will offer a standard set of comprehensive benefits. These include medical, mental health, prescription drug, and rehabilitation services. When insurance plans become available through the exchanges in 2014, you will be able to pick among several levels of coverage. Having standard benefits will make it easier for you to compare both health insurance plans' benefits and costs. The law also provides some help for those who cannot afford coverage. In 2014, if you earn less than about $43,000 for an individual, or about $58,000 a year for a couple, you will get tax credits to help you pay your premiums for health insurance purchased through the exchange. As you know, among the uninsured group are many young adults who are no longer covered by a family policy or don't have insurance through their job. In the past, young adults frequently were forced off their parents' policies once they reached 18 or 21 or graduated from college. But now, parents may be able to cover their son or daughter on their insurance policy until they reach age 26. This is an important provision. If you currently have your children on your health insurance, you can keep them on your family policy until they reach 26, even if they no longer live with you, are married, and are no longer in school. You do not have to claim them as a dependent on your tax return. However, you will not be able to include their spouse or their children on your policy. If your adult children are not included on your health insurance now, and you want them to be, you will be able to add them to your policy if your insurer provides family coverage. Your insurance company should have sent you or will be sending you a written notice about how to enroll your adult child if you qualify. However, if you're adding adult children to your policy, their coverage may not begin until the start of your new insurance plan year. Here are some other important things you need to know about young adult coverage. Your insurance company will not be able to charge you more to insure your older children than they charge for younger children. And they can't provide your older children with fewer benefits than your younger children. Insurance companies and employer-based plans are not required to offer family plans. If you are in a group plan that does not provide family coverage, you will not be able to include your adult children on your policy. Also, if your adult children have access to coverage through their jobs, you will not be able to add them to your plan. To be insured, they will have to take advantage of their employer's health plan. So you will want to be sure to check with your insurance company or with your employer to see if your adult children can be included on your family policy. Another way the healthcare law helps uninsured people is by expanding the Medicaid program. Medicaid is a health insurance program for low-income people that is jointly funded by the federal government and the states. It covers children, older persons, disabled persons, and others. Medicaid is required to cover low-income women with children. In some states, adults who do not have children can enroll in Medicaid. Other states do not allow adults without children to enroll in Medicaid, no matter how little they earn. But starting in 2014, you will be able to enroll in Medicaid even if you are an adult who does not have children. You would need to meet the income limits, which are currently about $15,000 a year for an individual and about $20,000 per year for a couple. Note that these figures will most likely change in 2014 when the Medicaid program expands. So what about people with pre-existing conditions? I mentioned a bit earlier, this year, children under age 19 cannot be denied health insurance because of a pre-existing condition, such as cancer, diabetes, and heart disease. And this will apply to adults by 2014. In the meantime, if you have been uninsured and have a pre-existing condition, you may be able to get temporary health insurance coverage. This coverage is often referred to as the Pre-Existing Condition Insurance Plan, PCIP. Information about this coverage is available in your state now. To be eligible for the Pre-Existing Condition Insurance Plan in your state, you must have been uninsured for at least 6 months and have a pre-existing medical condition. It's important to note that people who apply for this temporary coverage will be accepted on a first-come, first-served basis. We really encourage you to take advantage of this program if you are eligible to do so. The Pre-Existing Condition Insurance Plan covers a range of benefits, including primary and specialty care, hospital care, and prescription drugs. In addition, all of these health plans must cover pre-existing medical conditions. Premiums will be based on a number of factors, such as your age and the state where you live. The temporary coverage available through the pre-existing condition insurance plans will end in January of 2014 once the state-based health insurance exchanges begin offering coverage. For more information on the pre-existing condition insurance plan in your state, visit www.pcip.gov. Let's turn now to people with Medicare. What changes does the healthcare law have in store for this group? The law aims to improve Medicare by requiring Medicare to spend more wisely. If you have Medicare, your guaranteed Medicare benefits are protected. This includes doctor and hospital visits and rehabilitation services. This is true whether you have original Medicare, which includes Part A and Part B, or a Medicare Advantage plan. You will also receive improved benefits. For example, improvements to Medicare will lower your out-of-pocket cost for prescription drugs. Let's take a minute to review the Medicare Part D coverage gap or donut hole. I know this can be confusing. So here's a visual presentation of the donut hole that may be helpful. Starting on the left side, this is your initial benefit period where you pay your Part D deductible and about 25% of your drug costs. Moving to the middle, once you reach the initial coverage limit, you are in what is commonly called the coverage gap or donut hole. You reach the donut hole when you exceed a certain amount, which in 2011 is $2,840.